behind us. Your patience during this very challenging time is definitely appreciated. I want to start by providing an update on some real positive information that we just received because sadly we know that testing is very limited. In San Francisco, the Department of Public Health, they've been able to administer now 150 tests each day. That does not include the private hospitals, and this is information that we anticipate that we will receive sooner rather than later. We expect to increase that number significantly, and Dr. Colfax will provide an update on where we are with testing and how we expect to extend our testing efforts more significantly than we have in the past. But the good news on that front is now, thanks to Kaiser and Blue Shields, we will be able to provide testing for the healthcare workers who are on the front line and working with patients who have been infected, as well as many of our public safety officials, our firefighters and police officers, and those who are on the front line. We will prioritize them for testing. We know that so many of them are very concerned that they are doing this work in the community. They are trying their best to help save lives and serve the public, but they are living in fear as to whether or not they have the virus, and they're concerned with going home and spreading that virus to other family members. We know that's a big concern, so getting the ease of knowing whether or not they have the virus or not is critical to protecting public health and safety. And so we will be prioritizing public health and public safety officials for testing. And Dr. Colfax will talk a little bit more about that as well. And I want to just also mention to the public that although we want to be tested, I know everyone wants to be tested to know and think that that could put an end to what we are experiencing. And I want to be clear that in light of having sufficient testing for all San Franciscans, social distancing is the key. And I know I keep mentioning it, but I can't mention it enough because regardless of how many tests or who we're able to test, that at the end of the day is going to make the most impact. So please continue to practice social distancing. I want to talk about, since today's Friday and the weekend is approaching, and we know what happened last weekend. What happened last weekend, you did see people who were out, of course, enjoying the fresh air, walking their dogs, walking with their families and kids, and practicing social distancing. But sadly, we saw a number of areas in our city that were just jam-packed. And we also saw people who were playing things like volleyball and basketball and other sports together that are not things that we are able to do at this time as a result of the order. And so just to make it clear, we are going to have to make some changes. The last thing I want to do, as I said on Monday, is to basically close parks. And so we need to shift our behavior and make adjustments so that people are not doing the kinds of things that are going to lead to the spread. As we go into this weekend, I just want to appreciate the fact that we've been able to close places like Alcatraz, Fort Point, and Land's End Lookout. And the federal government has already announced parking closures in the city, including Baker Beach and Ocean Beach on Sloth. So if you are trying to go to Baker Beach or Ocean Beach or Crissy Field, the parking will not be available. And we will be monitoring the neighborhood to make sure that there isn't an influx of vehicles that are impacting the parking in those particular neighborhoods. We don't want people to get in their cars and drive to Ocean Beach. What we want people to do is stay at home, and when they need to go out and get some air, walk outside, go and to a park within the proximity of your neighborhood. Please don't get in your cars and drive to Ocean Beach or Crissy Fields or other places like that. So we're going to be closing parking lots in Crissy Field, Fort Funston, and the lots in the marina and Ocean Beach, as we said, and specifically near Beach Chalet. So we hope that by closing this area off to cars, that people will start to get the message of why we are pushing folks to really try and stay, get your fresh air, walk your dogs, but don't get in your cars and drive to specific locations to play volleyball with your friends, to have picnics, to have wine parties. Zoom is a great tool to have wine parties and other connections with one another, with friends and family members. I've just discovered that as a very great tool for socializing. But the last thing we want to do, as I said, is to start to close the last bit of fresh air that we're able to get during this very difficult time. And so parks, we know, are essential. And I know other places have chosen to just close parks and other places down. We don't want to get to that place, but if we see more people playing in basketball courts, if we see more people playing volleyball with one another and baseball and some of the sports that are more team related, we will have no other choice. So it's still okay to go out and walk. It's still okay to go out and ride your bike and run. And I just want to give a message to the runners because I had an experience when I was out walking yesterday. I was walking in a narrow area, and the runner still decided to run very close next to me. It would have taken like 3 seconds for the runner to wait until I crossed the bridge area to get by so that we could maintain that 6 feet. So I'm asking people to be considerate of one another. I'm not asking you to go out in the street and risk getting hit by a car. I'm asking you to just maybe wait a minute or two to allow people to pass within a safe distance. Again, we all can play a role in making sure that social distancing is practiced by everyone. And the fact is, we're in this for the long haul, so there's no need for any of us to be in a hurry. I want to also talk a little bit about what's happening with our homeless population. Because we know that there are so many people who are very concerned about what this could mean, not just for the people who sadly are sleeping outdoors, but what does this mean for people who are in congregate living settings like Laguna Honda, our single room occupancy hotels, and all of these other places. And so we have been working on a number of things, and I just want to talk a little bit about what we have done and what we will continue to do, and hopefully give people an update on where we actually need to get to as well. Starting next week, Moscone West will open up, and supplies are being delivered this weekend. People are being coordinated. We're going to use Moscone West as a place to thin out our shelters so that we can start to have places so that people who are, again, living in congregant settings like our shelters can be spread out a lot more. So Moscone West is going to play an important role for that. And we'll have some more information about that later on. And I also want to talk a little bit about the hotel rooms. As was mentioned earlier this week, we put out an RFP for hotel rooms that can be used for people who are in congregate living settings, people who are homeless, as well as some of our first responders and our healthcare workers and those who may not want to go home because of their concerns around impacting their families. And we have been able to, because there's, even with this declaration of an emergency, there's still a process, there's still insurance that needs to be worked out, there's still staffing needs and security needs and support and resources. And so far we've been able to, this week, secure at least 300 hotel rooms for self-isolating or for quarantine for either folks in our SROs or people who are homeless. And we estimate that by next week, we'll be able to secure at least another 3,000. So bringing on, as we said, some much needed hotel rooms, and we will keep working towards, making sure that those people who are in congregate settings and other places have a space. to themselves so that we can reduce the transmission of the virus. And so that's the update that we have so far. I want to take this opportunity to especially thank the people who are here at Moscone South, the people who are here working every single day in the Emergency Operations Center and doing the hard work, coordinating the hospitals and the PPE and testing, the stuff that we're doing, just the small things, like even making sure that the shelters are still getting food, that we are getting food to seniors and other people, that we are talking and reaching out to those businesses who still have remained open or have some real challenges financially and need help. So many people here at the Emergency Operations Center have stepped up to do their part in providing information and resources to the public. And we really also want to express our appreciation because we have gotten a lot of great ideas from members of the public through social media. People have made a lot of great recommendations, and we take those recommendations to heart because we are all in this together, and no one is in charge or responsible for all the great ideas. It's going to take a team effort. It's going to take all of us working together, looking out for one another. And I want to also just really express appreciation to so many people in the city, because I noticed that on places like Nextdoor and in some of these chat rooms where neighbors are communicating with one another, I noticed that so many neighbors are looking out for their neighbors who are seniors and people who can't necessarily get out to get their groceries or their medications. And so there have been so many great neighbors running errands for so many people who can't get out. And it's just, you know, it's a challenging time for all of us, but it is definitely bringing out the best in us. And so I just want to express my appreciation for so many people who are not only doing their part to stay at home and only go out for essential needs, but also what you've done to help touch the lives of other people who can't take care of themselves in the same way. So that's where we are. That's our update. Lots more work to do, but as I keep saying over and over, we are, yes, in the midst of this, so it may feel like this is very challenging for all of us, and how much longer can we take it? Well, the fact is we're going to have to take it a little bit longer because it does mean that we save lives. And so, again, we appreciate your patience and your cooperation. We'll continue to do everything we can to provide updates as we receive them with the most accurate information so that the public knows what to expect. Because, as I said before, the last thing we want to do if someone is facing a medical emergency, the last thing we want to do is turn them away because we don't have enough beds. So let's keep that in mind as we go into the weekend, and let's try to remember that and do our very best to get through this. I'm cheering for all of you. I'm cheering for our city. I'm cheering for our country. So thank you all so much for your cooperation. And so at this time, I'd like to introduce Grant Colfax, the Department of Public Health Director, to provide us with an update on the latest numbers, the testing, and other information that I just touched on briefly. Dr. Colfax.
Thank you, Mayor. Good morning. I am Dr. Grant Colfax, Director of Health. Today, I am bringing several important updates. I will talk about the situation at Laguna Honda Hospital, protecting healthcare workers, and significant new expansions of testing. But first, let me remind everyone, We need San Franciscans to stay at home to save lives. I also understand that some of us are essential workers and cannot stay home right now. However, if I could stay at home right now, I would be staying home for our first responders and healthcare workers on the front lines. As we continue to respond to this rapidly evolving outbreak, we are always thinking about what's ahead and what's about to come next. In February, we had 0 cases of coronavirus, and yet we realized that we were in an emergency situation and immediately strengthened our planning and preparedness capabilities. The day after our first 2 confirmed cases in early March, we made aggressive social distancing recommendations. We have continued to tighten that up as we move forward, with the entire Bay Area on shelter-in-place orders for all residents. And that was just last week. We have issued an unprecedented 13 health orders in the last 3 weeks. Each one was designed to protect the most vulnerable populations and healthcare workers and take pressures off hospitals so that they can handle an expected surge of new patients. Each one was designed to keep the community safe and slow down the spread of the coronavirus. Each one was grounded in data, science, and facts. As we continue to plan, predict, and respond, sometimes we are ahead, sometimes we are right on time, and sometimes we may be a beat behind. But so far, we have been preparing for just what is happening now. And we will continue to use data, science, and facts to be as proactive as possible to protect our community and reduce the harm that the coronavirus causes. I want to turn to the hospitals, particularly Laguna Honda Hospital. Yesterday, there was quite a bit of news in our own public health care system. Coronavirus has arrived at Laguna Honda. Unfortunately, this was not a surprise. The pattern of the disease clearly shows that long-term care facilities and their residents are particularly vulnerable to the disease and the spread. From the start, we have taken many steps to protect the patients and staff at Laguna Honda, and we will continue to do so. Earlier this week, the entire campus was quarantined to protect residents and staff and reduce harm. However, I must say, and I am sad to say this, that we do expect an outbreak. Our plan for the outbreak includes testing affected staff and residents, which is already underway. We have begun bringing in additional resources, including staff and expertise, on long-term care, infection control, and infectious disease from our own DPH system, but also reaching out to key partners, including UCSF and Sutter Health, to strengthen our response. This strengthening will continue over the next few days and weeks. With things moving so quickly, I want to make sure you get the facts straight from the source. I can confirm that as of yesterday, there are 6 staff members and 1 patient at Laguna Honda who have tested positive for coronavirus. All of them are in good condition. Contact investigations are underway, including testing, and those units have been quarantined. Yesterday also brought news of a confirmed case of a staff member at Zuckerberg San Francisco General Hospital. This person provides patient care in the emergency department and is now self-isolating at home. We are conducting a thorough contact investigation. It is concerning to hear about these cases. It will continue to be concerning as the cases in San Francisco grow. We now have almost 300 confirmed cases in San Francisco, and each person is someone with family, friends, and community who care very much about them. The health department cares very much about them. With regard to testing, as the mayor and I have said over and over again, expect to see an increase in positive cases. And with regard to the increased infections, do not be surprised because we've been increasing our testing capacity throughout the city. Simply put, the more testing we can do, the more cases we will find. We've also taken steps to make sure we are getting the data we need to be successful as possible in our fight against the virus. On March 24th, Bay Area health officers issued a joint health order requiring all labs, commercial or academic, to report all test results to the state and local health authority. This will help us be more precise and know across San Francisco, across our community, how many tests are being done and what is the positivity rate. We simply need to know where we are to better understand where we may be going. This increase in data will be used to refine our models and our strategies to mitigate the virus spread. And we are working with the foremost experts from UCSF and UC Berkeley to enhance our modeling capabilities. We truly have some of the world's greatest experts on virology and disease epidemiology, both nationally and internationally, working with us every day. As availability of commercial and academic labs have grown, we have also been looking internally at ways we can boost our own public health lab testing capabilities. From when we started testing on March 2nd to today, we've increased our testing capacity by 3 times through automation of certain processes. We are now running 150 tests a day, up from 50 when we began testing. And I am pleased to say that by next week, we are hopeful that we will surge that testing to as many as 450 tests a day in our public health lab alone. Our plan is to keep improving our testing capacity and further in the next few weeks. We are also continuing to work with private partners to expand even more testing for the public. We have great partners at Kaiser, UCSF, CPMC, and Sutter that have been offering drive-through testing. And next week, thanks to Mayor Breed, we're excited that we're adding 3 new drive-through drop-in centers for testing through our partnerships with NEMS and Brown and Tolan. However, let me be clear that even today, whether you are a public health laboratory or a commercial lab anywhere in the nation, there are still severe shortages of critical components needed in the COVID-19 coronavirus testing process. Supplies nationwide are becoming a severe bottleneck to increase testing. I am sad to say that from swabs to PPE, the lack of testing supplies across the nation simply means that we must prioritize our testing for those who need it most. At the Public Health Laboratory, we have been prioritizing our limited testing resources for those most at risk for spreading the disease, those with severe medical conditions, and our frontline healthcare and first responders. Today, we have issued instruction to all labs and clinicians that they must prioritize their test in the same way. Tests should not be available for those with Tests should not be more available for those with resources. They must be prioritized for those on the front line saving lives and those vulnerable and high-risk groups that need care. Please, please prioritize, help us prioritize those tests for those who need it most. Their lives depend on it, and to prevent the prevention and the reduction of the spread of coronavirus in our community depends on it. I now want to talk a little bit about additional steps we are taking aggressively to protect healthcare workers. Our frontline workers and healthcare staff are essential workers and members of our community. As coronavirus circulates in the Bay Area, we expect there will be more positive cases in San Francisco, including, unfortunately, among city workers, DPH staff, and healthcare workers at both public and private facilities. Our top priority is the health of our patients, our community, and the people who fight for them and support them. We are doing the very best we can to be as prepared as we can in fighting this disease. Healthcare workers and first responders are courageously on the front lines every day. Yesterday, we took additional steps to respond to the impact of the virus on our DPH workforce. Because of their jobs on the front lines, many healthcare workers cannot abide by the stay-at-home order. They are essential, and in some cases, their workplaces do not allow for social distancing. In fact, quite the opposite. Several jobs in our healthcare system involve close contact with other staff members in vulnerable populations. For example, the emergency room, psychiatric emergency services, and urgent care center at Zuckerberg San Francisco General Hospital, the Laguna Honda Hospital, and other settings where staff have prolonged contact with each other and high-risk patients. These workers come to work every day where they are at risk for community spread, for transmitting the virus to each other, and for exposing the high-risk populations they serve. So we have issued new guidance above and beyond CDC recommendations to provide isolation masks for people who work in these settings in our healthcare system. We will be providing isolation masks to workers and patients in many at-risk settings. This is another way we can protect both groups. We are doing our best to balance keeping our workers safe as possible in the high-risk areas while also being constrained by a limited supply of masks. We will continue to advocate on many fronts for more masks and other personal protective equipment, or PPE. But I feel it is essential to move forward with these additional protections today. I can't stress enough that every healthcare provider in the city, from hospital CEOs to doctors, nurses, and other frontline workers, wants there to be enough PPE for the patients and the healthcare staff. PPE is in short supply everywhere. We are working hard to make sure the supplies are here when we need them. That includes state and federal advocacy, working with large donors and through the supply chain to secure the PPE we all need. Our top priority is the health of our patients and the people who care for them, and PPE is an important part of what is needed to do it right. Finally, I want to remind all San Franciscans of the importance of following the stay-home order to protect yourself, your loved ones, and our entire community. If you aren't performing an essential task to keep our city running right now, then you only have one job. Stay home and keep yourself safe. Thank you, and I would like to introduce Chief Scott, who has been a great partner in this work, a great partner with his teams who are on the front lines, helping us keep our city safe. Chief Scott, thank you for your leadership. Thank you for your partnership. And please look forward to your remarks.
Good afternoon. First of all, I want to thank our mayor, Mayor London Breed, for her leadership during this unprecedented public health crisis. I can speak on behalf of the men and women of the San Francisco Police Department. We are extremely grateful to our mayor, Mayor London Breed, and Dr. Grant Colfax, that they have made safeguarding the well-being of San Francisco's first responders a priority. Our city's police officers, sheriff's deputies, firefighters, and other first responders provide the first line of public safety in San Francisco and we need to keep them safe and keep them healthy. So again, I want to thank Mayor Breed and Dr. Colfax for making first responders a priority in testing for COVID-19. We're constantly on the front lines, and we are expected to always be there. By providing this testing, we can help slow the spread of COVID-19 among our first responders so they can continue to provide public safety and protect the health of the public at large. I'd also like to thank our city's hotels because they have stepped forward to offer rooms to our first responders who may have to quarantine because of the COVID-19 virus. Having this support from our city leaders and from our city at large strengthens our morale, strengthens our health, and strengthens our resolve. And we know that we will need to have resolve during this crisis because we don't know how long we're going to be in this position. The mayor mentioned some of the areas where we've seen gatherings over the past week, and I want to lay out what you should be expected or will be expected to see this weekend from us, from law enforcement. This weekend, we're going to have people out. There will probably be a lot of people outside, as there were last weekend. But please be smart and adhere to the public health warnings of social distancing. I cannot emphasize that enough. Use common sense, be smart, and expect to see us out there. It doesn't make sense for people to be out and not pay attention to the social distancing requirements, 6 feet, as laid out by our health officials. We've seen in other cities that are having a harder time right now than we are. We've seen gatherings in this city that have put others at risk, and we need everyone to think for a minute of who you are putting at risk when you do not adhere to public health warnings. Think of your grandfather, think of your grandmother, think of your sick child, think of the other people who you may be putting at risk by not adhering to this public health order. We'll be out this weekend in some of the places where we've had issues with gatherings. That include the Embarcadero, Dolores Park, and other city parks, the Marina Green, the Panhandle, Stern Grove. Exercise facilities in the park, as the mayor's laid out, will likely be closed in many of your parks. We've seen, by and large, excellent compliance from the people in San Francisco. We want that to continue. As we have laid out in previous press conferences, we have enforcement protocols, and for those of you that are interested in knowing what they are, you can find them on the San Francisco Police Department website. Our approach has been progressive. We have started with education, and we will still educate the public. When this public health was put out on March the 16th, we had this many people, a lot of people who didn't get the message. And as we have educated, that number has gotten smaller and smaller with the people who have not complied. And we do think that education has worked. However, education can only go so far. And there will come a time where we will have to enforce. Now, our officers have been very patient. They understand what's at stake here. They understand that we're looking at the end game of compliance, and this is not about a count of how many tickets we write or how many people we arrest for this misdemeanor violation, because we don't want to create problems by enforcing the law. Our Sheriff Miyamoto, has been charged with reducing his jail population, so we don't want to make the problem worse. So please, I can't emphasize this enough. Please listen to the public health officials. Social distancing, stay 6 feet apart. We want people to go out and get air, but our officers will be engaging. They will be communicating. For those that have been warned repeatedly, there will come a time where we will have to enforce, and that is a fact of life. We hope we can avoid that, and by and large, people have been complying, but please listen to these public health orders. I cannot emphasize that enough. We want everyone to use just good common sense. Stay 6 feet apart. If you're going to exercise, have respect for others around you. If you're going to go to the grocery store or wherever you need to go to keep essential items in your household, practice those same protocols. If you have to stand in line and wait to get in your market, your grocery store, stay 6 feet away. We've been actually putting out photos on our website of people who have done just that because we want to show that by and large, San Francisco's population, our residents, we get it. We understand what's at stake. We want to catch you doing something right instead of catch you doing something wrong. This weekend, you will see us out there, and from the bottom of my heart to our mayor, to Dr. Colfax, to the city leaders, on behalf of the first responders, we really appreciate what you have done as far as prioritizing testing sites for first responders. The last thing I'd like to say is we also understand that community leadership is a big part of getting compliance from the people in our city. And with that said, I'd like to introduce one of our community leaders, Marcia Contreras, who is the Deputy Executive Director of Mission Housing. Thank you.
Hello, I am Marcia Contreras, Deputy Executive Director for Mission Housing Development Corporation, and a community leader and servant of our Latinx community. Because I'm representing our Latinx community, my message is going to be in Spanish. Hola, mi nombre es Marcia Contreras y soy la directora asociada ejecutiva de Mission Housing, una organización no lucrativa, y soy líder y servidora de nuestra comunidad Latinx. Primero quiero agradecer a la alcaldesa London Breed por sus acciones apropiadas y estratégicas que ha tomado desde el comienzo del brote del coronavirus o COVID-19. La orden pública de salud que fue implementada de quedarnos en casa salvará vidas si la respetamos y la seguimos al pie de la letra. Yo personalmente me estoy quedando y trabajando de mi casa por la salud de mi familia y la de mi madre, que se considera de alto riesgo. En este momento, le pedimos que hagamos nuestra parte individualmente para ayudar y para detener el contagio de este virus. Por favor, quédense en casa. Juntos podemos salvar vidas. En este día estamos lanzando una campaña por medio de los medios sociales y lo invitamos que ustedes mismos desde su propia casa puedan diseñar un video en el cual usted puede decir por quién se está quedando en casa, por qué razones lo está haciendo. Y en espíritu de solidaridad nos gustaría, escuchar de todos ustedes.
And right now you're listening in on San Francisco Update dealing with the coronavirus. This is a message to the Latinx community. But we heard from Mayor London Breed as well as Dr. Grant Colfax and Chief Bill Scott. They all talked about, basically, the big thing we heard a lot was social distancing. They're reminding people to keep their distance. They know that this weekend people will be out. They said last weekend they saw a lot of people, but they want to remind people to stay distant from each other or stay at home if you can. Chief Scott did say that they don't want to have to enforce this, but they will enforce it if they have to. Also, they told us about this drive-through and drop-in testing sites that they will have throughout the city. There are 3 new mobile testing sites, and those will be for people throughout the community. They say the healthcare workers and first responders will get the first priority with those tests, but they will continue to do those tests. They say they actually increased those tests by 3 times. Usually they would do about 50. Now they're up to 150, and they're looking to get to 450 a day. That's the goal that they're trying to reach. They also talked about housing. They say right now they do have 300 hotel rooms available for those first responders and people needing a space to quarantine. And they say they're looking to possibly have even secured 3,000 by next week. They also say that the Moscone Center will open next week. This will be a part of the shelter, as a lot of those shelters are becoming overcrowded as people are trying to social distance, and they want to make sure that they have that available for a lot of people. Mayor London Breed reminding people that Baker Beach, Ocean Beach, Crissy Field, all the parking in those areas will be off limits for anyone. You only can access those areas by walking, but they still want to remind people the social distancing and to stay clear of each other, because they want to continue that, because they said that has been effective in dropping the number of confirmed coronavirus cases within the city. And they say they do expect more cases as they continue to increase the testing. There will be more confirmed cases of coronavirus within the city, but they're continuing to do the work to try to make sure that everyone is safe and healthy throughout the city. Now, we will continue to monitor what's going on with that press conference. We're going to bring you the updates online through Facebook, Twitter, as well as Instagram. We will update you on that information. We're also going to update you coming up tonight at 5 and 6, as well as our special coronavirus coverage at 7 o'clock tonight. For now, we're going to send you back to regularly scheduled programming.